Hello and welcome to IPC Touchpoints, an expert insight series brought to you by Georgia Pacific. I'm your host Abhi Zadav, the Director of Healthcare Insights at GP. We have a pretty interesting topic today for you, how standardizing IPC programs can alleviate staffing challenges. And I have the pleasure of having Linda Dickey with me today. Linda is the past president of APIC and has over 3 decades of experience in the field of infection prevention and control. Linda, thank you for joining us here today.
Thank you for having me.
So acute care facilities have seen a lot of turnover, and that means that they've had to hire temporary staff and new employees. So why is it important to standardize IPC processes, and how can it alleviate staffing challenges?
Well, even with people that are veterans and are not new, those standard processes help, but certainly when we've brought in new workers and temporary workers, any type of variation in processes introduces the possibility of error, and it also increases stress on workers. So to the degree that we can have processes and products and systems that are consistent and standard, it just helps people work together and better as a team, and it helps reduce the individual stress. Any opportunities that an organization can do that within the organization and across, if they are a multi-system organization, will only make their workers feel more comfortable and perform better.
And you mentioned consistency, and that is so important because the staffing challenge is not going away anytime soon. So what do you think acute care facilities can do to help get back on track?
Well, one thing that we're learning, and there are data and papers about this, is that the culture of an organization is really important. People need to feel safe in a work environment, and that safety isn't only focused on the patients, but also the workers themselves. And just a very simple example, finding something like hand hygiene dispensers in consistent places throughout various units, and then when you go from floor to floor, people know where to find it, they know how to use it, and it gives them one less thing to have to think about. It seems minor, but if you multiply that across the environment, it really does reduce stress, and it helps people feel more comfortable working in their environment.
And so that consistency and standardization is key. How does that apply when facilities select and review products, for example?
Well, I can give you an example. We were putting together a central line insertion kit, and everybody kind of had their own opinions of what they wanted to go in the kit and how they wanted the kit laid out. But we did have frontline people that, physicians and nurses, those that are engaged in the work, actually work with different layouts of kits and different products, came up with something that we could all agree on after a period of time. And what that did is that it really made it a reliable process so that people knew exactly where everything was laid out, they knew where the kit was stored, they knew what it looked like, we had visual cues. Those types of things make it safer for the patient, make it safer for the worker, less stick injuries, cuts, that type of thing. And it also helps alleviate stress. So having direct providers involved in a selection process and making it multidisciplinary, it really makes a difference.
And it sounds like familiarizing new employees and temporary staff with the practices of hygiene and how that supports reducing HAIs is pretty important. Can you talk to us a little bit about that?
It is very important. And most of the HAIs that occur, not all, but the majority of them come from the patient's own skin flora or sometimes from the healthcare worker. And so the worker hygiene, for example, hand hygiene, and hygiene of the patient's skin, for example, is critical to be able to reduce the patient's risk of healthcare-associated infection. You would think that hygiene products are pretty basic and people use them routinely when they work in healthcare, but there is nuance to products, and I think it's important for people to be introduced to that nuance, whether it's some sort of a visual cue, stickers, signage, or just something that's included in orientation, someone to be able to demonstrate, this is our This is the hand hygiene product we use here. We dispense about this much in our hand, and it rubs in really quickly. Just a very simple, quick demonstration to make someone feel comfortable with it goes a long way.
And so as you touch upon products and communication cues, can you talk to us about how valuable you consider staff training and reminders?
You know, it is important because we can just take for granted that people coming into an environment, whether it's a new worker or a temporary worker or someone who's floated to a different floor, we can take for granted that we think that they know everything there is to know just because they work in the field, or they're a healthcare worker, they're a physician or a nurse. But having some degree of information provided to you, again, it puts people at ease, it reduces their stress, it makes them feel welcome. Even the basic products, this is where we store this. This is how we refill it if there's nobody around to be able to do that at the time. This is how we use it. This is how we warm it. Whatever the product is, it will help somebody, again, just feel more comfortable, feel more a part of the team, and be able to use the product effectively. We definitely see when we have surveys, regulatory surveys, that the surveyors look and they watch to see if people know how to use these products, even, again, very basic products. And so we want to make sure that people are very comfortable with them.
Thanks for sharing. Those are some great perspectives, especially on how to navigate staffing challenges and how to carefully review and select products. This is a lot. Can you help us understand what facilities can do going forward?
I think one of the most important things that facilities can do and should do, if they're not already, is to recognize the importance of the culture of safety in their organization. People need to feel, some of them need to be wooed back into healthcare. And for those that are there, we want to retain them. And part of that is making them feel safe in their environment and like they have control in their environment. And part of that feeling of safety and control is consistency and reliability, and that they're working in an environment that is going to work for them. So I think to the degree that organizations and leaders, top leaders, get that and understand that in order to bring people back into healthcare or to keep the ones that we have, we need to have a culture that focuses on safety. It's important, and it's not to be undersold.
Mm-hmm. I want to thank you, Linda, for meeting us here at Georgia-Pacific. And we like to say healthcare experts meet hygiene experts. And we value experts like you who are keeping the healthcare community informed.
Thank you so much. It's great to be here.
And folks, I hope you can tune in for additional installments of IPC Touchpoints Expert Series. Thank you.